And we are live. Hello, Dr. Zoe. How are you?
I'm very well, thank you. How are you?
I am very well indeed. So we are talking about sleep, food, and supplements, which is
Yes.
an interesting topic. And just before we get to that, in terms of sleep, how badly are people affected by it? How widely are we affected, and how does it affect us, and why?
So I think in general, people are sleeping a lot less well and they're sleeping for less than ever before. So when they look at how we used to sleep about 80 years ago, we're sleeping an hour or so less on average. And so we tend to sleep less, and partly that's because we live in this sort of 24-hour society. Everyone takes their work home, everyone goes to bed later. People don't care about sleep. If they feel like they can lose a bit of sleep and do extra work or socializing, and it's been really deprioritized. So in general, we sleep less than ever before. And then I suppose you add sleep disorders in. So things like insomnia affect up to 1 in 3 of us. So it's incredibly common to have poor sleep, and that's where you struggle falling asleep at the beginning of the night, or you wake in the middle of the night and you can't get back to sleep, or you wake really early in the morning and you can't get back. And that often, if that goes on for a while, it's called insomnia. So up to 1 in 3 people suffer with that. It's really, really common. It's the most common sleep disorder. And of course, then you might hit the menopause, and it is a really common time to struggle with sleep. So the statistics say 40 to 60% of women will suffer with sleep problems during the perimenopause and menopause. And actually, I think it's probably more common than that based on some questionnaire studies that are a bit more recent. So it is very common. And I suppose I think one thing that has happened over recent years is people are starting to see the impact a little bit more. So people will recognize that actually losing sleep, not having enough sleep, can affect their work, their function, their quality of life the next day. People feel tired, but also it can affect other things like memory, performance, that type of thing. But there has also been evidence about, long-term ill health and chronic illness being related to sleep. And there's lots of studies about dementia being related to having not enough sleep. So I think the knowledge is out there, and people are taking it more seriously. I suppose in my clinic, the thing that I find people suffer the most from is mental health, the impact of poor sleep on their mental health. So it can just lead to so many problems, anxiety and depression.
Do we know why it gets worse around menopause? What is it about menopause that makes sleeping more horrendous, apart from hot flushes and that kind of stuff?
Yeah, so, well, it is a bit of that kind of stuff. So there's loads of things. So just the hormone changes themselves. So progesterone drops first in the perimenopause. And we know progesterone is quite a good calming hormone, and it can be quite sleep promoting. So perhaps the drop in progesterone sometimes triggers sleep disturbance quite early on, quite an early thing to happen in the perimenopause. But also just, the chaotic estrogen and then the drop in estrogen. When that happens, we just see reduced quantity and quality of sleep. So just those hormone changes alone can affect sleep. But then you add in all the night sweats, all the hot flushes, the temperature changes are really significant. So when we fall asleep, we need our body temperature to drop a little bit to allow us to sleep. And when you've got all these, temperature changes, it's really disruptive. So that's a lot to do with it. But also getting up to wee in the middle of the night, that's happening more at menopause. So it's disturbing sleep. And again, the mental health side of this. So if people are anxious in the menopause, then quite often that will create a little bit of a vicious cycle where they can't drop off their worrying, or they're lying awake worrying, and that can affect it too.
Absolutely. Now, as we know, the market is awash with supplements and sleeping tips and God only knows what else.
Yeah.
Shall we start with food first? I mean, the old adage, if you have a glass of, did you have Horlicks here?
Yes, Horlicks, yes.
Yeah. So a cup of Horlicks or a cup of Horlicks of warm milk, or whatever it is, and then you pop to bed and you're full asleep. Are there certain foods or drinks that apart from alcohol, that can help us get to sleep and perhaps even stay asleep longer?
So I think the first thing to say is you won't find a silver bullet that works for everybody. There's not going to be one food, eat this, and your sleep will be improved. But there have been lots of little studies that show something might help a little bit, something else might help a little bit. So there are some really good ideas. It's also worth saying that you won't find any foods in any of the sort of sleep guidelines or the recommendations, because nothing has been studied enough to help everybody. So they won't include them. But I think there's probably some things that could help, and they're all around helping to add extra melatonin, which is a hormone that helps regulate the timing of our sleep, or some of the precursors to melatonin and serotonin. And these are hormones that help with the generation of sleep. So anything that kind of helps boost those levels is something we think might be helpful for sleep. So to start with, I bought some props. I have things to remind me. I know. So there has been, these are actually things that have had a quite good, small studies, but good results. And kiwi fruit.
Oh, it's a kiwi fruit.
It's a kiwi fruit. So kiwi fruits, actually, they did a study where they had 2 kiwi fruits an hour before bed. And they actually, you had to eat the skin, which I don't know if is, I don't know if it's that nice. I don't tend to eat skin. But in that study, people did have quite a significant extra bit of sleep. So it was about 20 minutes extra sleep, which is quite a lot. You don't see that from many medications, actually. So kiwi fruits, and it's thought to have melatonin and things that really boost the kind of sleep timing. So kiwi fruits are quite popular for sleep.
And also, how long before bed did you say? 2 hours?
It was 1 hour. It was eating it. The study was eating it an hour. So a good bit of kiwi an hour before bed might help. You know, it's certainly a healthy food to eat. Also, cherries. Can you see those? Yeah. This is to remind me. So this is another really interesting study that they did where they used tart cherry juice. So it was actually the juice, not the fruits. And that was a really brilliant study. So in cherries, you've got lots of precursors to melatonin. You've got tryptophan, which is an amino acid that helps convert to melatonin. And they found that just drinking tart cherry juice, I think it was 2 small cups, and they did it in lots of different groups. And although they were quite small, people got something like between 20 minutes extra sleep and 80 minutes extra sleep, which seems absolutely huge. So it's definitely worth looking into if you want to have foods that promote sleep. Cherries and kiwi fruit are worth a thought. And actually, you know, the milk, the glass of milk you said, or the Horlicks, it's interesting because that's got a lot of melatonin in it, but it's also got calcium. And one of the things that you need to convert the tryptophan into melatonin is a bit of calcium. So there might be something in that. But I suppose it's also worth saying, I think the timing of what you eat matters as well. So it's quite important not to eat just before bed. When we're asleep, our body is our circadian rhythm means that we're not meant to be digesting food overnight. You know, all of that bit should be pretty quiet, not too much energy going on. So if we do eat right before bed, it can sometimes disturb sleep. Sometimes you get a bit of reflux, and that's not very helpful. But it certainly can be a bit disruptive. It also just increases the body temperature a little bit when you're metabolizing food, which again isn't very helpful for sleep. So there are other foods that have got melatonin in, like nuts. Pistachios are full of melatonin. There are various meats that have got tryptophan in. So there's always a bit of a sort of comment about Thanksgiving in America turkey being full of tryptophan, but I think actually chicken's got lots in, so you can have lots of things like that. So
salmon, I think some of the
salmon, oily fish can, and salmon's got melatonin and all sorts of goodness. And I suppose when we're talking about it, it's all about having a really varied diet and having lots and lots of different things. And because they all contribute in some way, you know, it's not just a little bit of melatonin, and it's not just a little bit of tryptophan. It's lots of different things. It's the calcium, it's the magnesium, it's all those things together.
Yes, and we should get to magnesium and those sorts of things. What about things like bananas and stuff like that as well? Do they make a bit of difference?
they've got potassium. Again, there's no good big studies on them, but they have got potassium, which you need to convert some of these substances, so that can be helpful. And actually, they did do a study, you know, the Women's Health Initiative study we talk about quite a lot with all the breast cancer. We know that study. And they actually had they had an arm of that study where they looked at people's sleep and the food they ate. And they found that the more varied the diet, the longer the sleep. And actually, if you didn't have very much variety in your diet, you were much more likely to have short sleep. And it's probably for all these reasons that the more.
And so when they're looking at that, it's probably not just what you're eating at night time. That's over you just.
Absolutely. Yes. In general. Yeah. There have been some studies that say Mediterranean diet, again, is better at promoting sleep. And we've heard that a little bit about other menopause symptoms as well. So there's probably something in it. And again, the Women's Health Initiative study showed that a diet that was high in protein was more likely to give you good sleep, and also high fiber and high carbohydrate. But it wasn't just any old carbohydrate. It had to be kind of complex carbs, because any real sugary foods, there is an issue with those. And that's probably one to avoid at night. Because whenever you sort of boost the sugar in the bloodstream, you tend to have a little bit of a crash 4 or 5 hours later. And so if you do have something sugary at night, the crash happens when you're asleep. And that can kind of create an increase in appetite, increase in kind of noradrenaline release in the brain, and that can be quite alerting. So you can find yourself woken and feeling hungry if you have sugar before bed. So that's definitely one to avoid.
All right, because that's a shame, isn't it? Because I mean, most people have a dessert at night. Maybe the French have got it right in their cheese after dinner.
Yeah, and actually, there was all that. Do you remember people used to say cheese gave you nightmares? So, and I suppose anything late at night, no one really knows if it's real. It has got a substance called tyramine in it that people are suspicious could affect things, but it's probably that just eating late at night makes you more likely to wake up. And when you wake up in the middle of the night, you're closer to where you've had your dreams and you kind of remember your dreams. So, yeah. So trying not to eat late and trying not to eat sweet things late. And it's difficult because when people are tired, they really crave sweet foods and fatty foods and unhealthy foods. So it's a tough one.
Yeah, it is. And if you had the choice between tart cherries and nice sweet cherries, you'd be going for the nice sweet ones.
Yes, you would. Exactly.
Yeah, exactly. Now, there are other things that are very, very important as well that things that keep popping up in the supplements area.
Yeah.
Things like, let's start with the melatonin supplement itself.
Yeah.
How does that actually work? Do we need it? Because some countries don't even allow it to actually do that. I mean, I know people are buying it online, but it is not sort of, are there problems with melatonin?
So I suppose it's pretty safe. It doesn't have too many side effects. However, it's probably being used wrongly quite a lot. And I suppose that's a problem if it's not doing what it should be doing. And so what melatonin does naturally is we actually do produce quite a lot of it, loads of it, from the pineal gland in the brain. So we think of melatonin as something we take, but actually we produce a lot ourselves. And it's produced, it gets released usually a couple of hours before bedtime, before sleep. And it's part of our circadian rhythm. So it happens really quite automatically. And it should happen at the same time every evening. And what it does is when it's released, it just tells us that it's nighttime. So it's called the hormone of darkness, but it will get released even if it's not dark. It tells us that it's nighttime and that we are, getting ready for sleep. And it kind of triggers lots of different processes in the body clock to start sort of settling down for sleep. But it doesn't make us fall asleep. So it's not a sedative. It's not a hypnotic medication. It doesn't actually make us fall asleep, but it does sort of tell us that sleep is coming. And so we usually don't need to take much more. There are some times that it can be helpful, but if we want to enhance our own melatonin, we can have all, the foods that we've talked about, our kiwis and our cherries, but also we can try to use darkness and light. So they are really powerful at giving signals that we need to have melatonin. So it does respond really well to darkness. So in the evening, it's why we always say...
Yes, instead of sitting in a room like this, it's bright. Yeah.
Yes. Exactly. So there is a real point in dimming the lights before bed, an hour before. And again, perhaps thinking about not using bright screens before, just because that does allow melatonin to be released in really high quantities and starts that kind of signaling for sleep. And again, the same thing the other way around is when you get up in the morning, having bright light that hits the back of the eye, ideally it would be daylight, quite early, it really says, right, switch off the melatonin now. So you get into this really good rhythm with light, switch off the melatonin with light in the morning and start encouraging it at nighttime with darkness.
Oh, so and when we do that, how much light in the morning do we ideally need? I mean, can you stick your head out for 10 seconds and go, okay, that's enough, or should we be out and about for half an hour? And is this why in winter you feel that you just? I think I posted something the other day saying I'm just not getting up again until next summer because I'm just over this. and if you're living in countries where SAD, seasonal affective disorder, is such a big thing, they say get that light out. So really get it out early. Is that? How much light do we need in the morning and for how long?
Yeah. So probably the more the better. So there's a big difference between the light you'll get inside and outside. So even if it is quite a cloudy day, as long as there's some light outside, it's going to be better for you than being inside. Sometimes you can do quite well by being by a really good window with lots of light coming in, but it is better to be outside. So I suppose sticking your head out the door probably isn't going to do the job, but being out even for 5 to 10 minutes can make a really, really big difference. And, if you really want to maximize the benefit, you would do some exercise as well. And then you are really giving your system that kind of message. But just any light in the mornings is really good. When it was locked down, it was one of the things we were really seeing is that people's circadian rhythm just seemed to change a little bit, their sleep timings, and partly because they just weren't leaving the house in the morning. They weren't getting the bright light. They weren't getting those signals. And people started actually going to bed quite a bit later, sleeping quite a bit later through lockdown. I mean, obviously they didn't have to get up, take kids to school and do work and things, or get out to work. So, but part of it was just not getting out and getting the light to the back of the eyes. So they are really useful things to enhance melatonin and really kind of train that circadian rhythm.
It's an interesting one because 99% of the time I work from home, and literally my day is like from bed to the desk, to the bathroom, to the kitchen, to the desk. And, I may not go outside until 4 or 5 o'clock in the afternoon or something ridiculous. And, you kind of think how bad that is for your sleep.
I think it is. And again, if you were doing that and you were having problems with your sleep, it can make a really big difference to actually get outside in the morning. And that's actually a lot of the work we did with people when it was lockdown was really like, let's just try and put some of that natural rhythm back in. And again, on the same sort of idea is exercising late at night also isn't necessarily good. So trying to bring that exercise earlier in the day, because it's so stimulating and it brings up the temperature so much that actually that sometimes disturbs sleep as well. So try and bring that earlier. Try and get the light in the morning. They can be really helpful for the circadian rhythm. So that's the melatonin that we produce. But there are times when actually we might not produce enough, or we could do with a little bit of help from a supplement, a melatonin supplement of some kind. And those times tend to be as we age. So as we get older, there is a point where the pineal gland starts to calcify a little bit and you might produce less melatonin. In the studies, it seems to happen in the kind of 60s. It's not usually 40s, 50s, but somewhere in the middle of the 60s, people can actually have less melatonin production. And that can impact on sleep. So if you are finding that you're struggling to fall asleep at the beginning of the night, or it just feels that sleep isn't as good as it was, then it might be worth trying melatonin. Now, in the UK, you can get melatonin licensed for use in the over 55s. It is only licensed for 2 weeks. So if it is helpful, you only get it for 2 weeks, and you have to think of something else after that, or see if you can take it for a bit longer.
In America, they seem to be able to buy it online. Everybody seems to be able to. Why here? And I think in Australia as well, maybe. I mean, I haven't been in Australia for over decades now, but it used to be as it was here. So, I mean, if there is no particular issue with it, why only 2 weeks? I mean, what are you supposed to do after that?
Yeah, it's a really good question. All sleeping tablets in this country are only licensed for 2 weeks. And I suppose part of the issue is, certainly with other sleeping tablets, they can be habit forming and they do have some other issues to them. in general, melatonin isn't. But I think one of the issues with it is, and again, I don't know whether this is part of the licensing issue, is that it doesn't seem to be that effective. So if it did help, I don't see much problem with continuing it. And I think most doctors would have a really reasonable conversation about that. But actually, sadly, it's a bit disappointing, and it often isn't that effective. So the studies we've got on melatonin suggest that at best, it might give you 2 to 3 extra minutes of sleep per night. And it's not a huge effect. So
you're better off with the cherries.
I know, exactly. The cherries did come out better. They were very small studies, but they did come out better. So I think that's part of the problem is melatonin sort of sounds good and it is really safe, but it isn't actually that effective because it doesn't, even if it puts your timing back, it doesn't help you fall to sleep. So there are other more effective things you can do. And I suppose the other thing is, you said in America, you can just buy it. There are issues with that. And that is the dosing of it and the regulation of it can be really very wild. And so they did a study a few years ago where they looked at what they said was in the melatonin supplement and they tested how much was actually in it. And it varied between something like 40 times or less than half of what it's, it was huge amounts of melatonin in some and then tiny amounts in others. And so it's really hard to know what you're getting. And again, even though it's very safe, you wouldn't want 10 times your normal levels of anything really, and that's not ideal. And I think also the supplements, you can buy all sorts of dose ranges, but we actually, for sleep, all of the benefit comes at the low dose ranges. So 1 or 2 milligrams, up to 5 milligrams can be helpful. But you can, on the shelf, they kind of compete with each other and say 10 milligrams or 15 milligrams. And actually, there's no evidence that the higher doses are helpful. It's all better to stick with lower doses. So there are a few issues with just buying it. But in general, if it is helpful, it's pretty safe. It's not going to do, it's not that no one's ever had any side effects, but they tend to be really mild and certainly nothing too dangerous there.
Good. Now, the one that's very popular at the moment is the CBD oil for a start.
Yeah.
What do we do about that with sleep?
Okay, so I think this is
a panacea for everything at the moment.
Yeah, I think it's one to watch. So the data at the moment isn't there for sleep. So the studies don't suggest that CBD does help sleep. So we can't recommend it for that. And there have been a couple of things that say, does it actually make you wake more? So there is kind of questions, but it has got good evidence for anxiety. And anxiety is so linked to sleep. So many people feel anxious after they've had a poor night of sleep. And then when they're anxious, they struggle to get to sleep or they wake up in the night. And so I think there is a potential use where CBD if it could help with anxiety, it could help with people's sleep in that way, if it could help with that. So I think there's potential there, but as a sleep aid, I don't think we can say that it is going to help. But I think helping with anxiety is a big thing for sleep.
Yeah, absolutely. 5-HTP, what is that and why is that so popular?
Yeah, so that is part of the pathway when you're moving from, I mentioned the amino acid tryptophan, and then it gets converted by an enzyme with a very long name into 5-HTP, and that gets converted to melatonin, serotonin. And so actually 5-HTP is the kind of middleman. And there was some thought that actually it could be helpful. It could promote serotonin release. It could really help with sleep. However, there's a real debate about whether it even crosses the blood-brain barrier, and there isn't much data on it at all. So I would say it would be better to think about foods that were going to help you in that way rather than taking 5-HTP. I don't think there's much evidence. Again, it could be things will emerge in the future and we just haven't got the studies, but I haven't seen it being helpful. I haven't found patients have found it helpful. So I think it's not one that I recommend.
GABA, that seems to be appearing all over the place as well. What is GABA and why should we be having that one?
So again, there is GABA is a naturally occurring neurotransmitter, and it is calming, and it's the one that is the most kind of calming neurotransmitter there is. So if we can enhance it in some way, sounds like that could help with sleep. Having said that, again, there are no studies that suggest it really helps with things like insomnia. But I can understand why people would want to kind of harness that effect. There are some of the things that we find in herbal remedies actually are meant to promote GABA. So valerian root, that's something that people sometimes talk about, and that actually tries to sit in the GABA receptors. And chamomile has got, I have chamomile tea to remind me. Chamomile is one of the kind of breakdown products of the chamomile is the apigenin, and that can again enhance GABA. Now, when you look at all of them, they don't seem to have a great effect when you test them. But I think some people definitely report improvements with these things. So, having chamomile tea is really, really common. Valerian is in lots of different kind of nighttime teas, and people do sometimes find benefits. So I think it's probably better to get it in that way. But GABA supplements, again, there's no evidence, but I can't say it wouldn't ever help.
Are there any risks that are associated with something like GABA, though? We're talking about neurotransmitters and things like that. Do we want to be playing with our neurotransmitters?
So I have heard that it can have some people report quite a dramatic effect, actually, and they start to feel, really sedated, really drowsy. And I suppose you have to weigh that up with the way that we would look at sleeping medication in general. So anything that is, going to sedate you and make you feel really drowsy could have some really significant effects. You could, certainly lead to next day drowsiness, be thinking about driving. And again, we don't really know what the consequences are of that. So I think be really careful if anything feels like it's really sedating.
Yeah, that's true. Actually, I hadn't thought about that. Anything operating machinery and all those sorts of things.
Yeah.
If we don't know what the sort of half-life of it is, it could actually be, if you get affected by it easily. Ashwagandha, that's another one that people are popping up and saying is a cure-all for virtually everything under the sun. Do we know much about that in sleep?
Yeah, so again, there is some research, and I hate to say it, it just doesn't show much benefit. It is something that seems to be an ingredient in you get all these supplements that have, lots and lots of different ingredients. And potentially, if you've got the right mix and the right thing, it could potentially be helpful. But at the moment, there's nothing to suggest that. And I suppose in clinic, I will see people that have tried all of these things, including ashwagandha, and it doesn't do anything. However, I think these things are pretty safe to try. So if you do want to give it a go, I don't think it's going to do you any harm. I suppose the only thing I would say is if you are thinking about trying these things over the counter, and there are all sorts of things out there, is that they're designed to be supplements. They're not designed to treat a disease or an illness or something like that. And so if you are just looking for something to boost your sleep and you try something that might help a little bit, that's fine. But if you are suffering with a sleep disorder and really struggling with your sleep and, waking up in the night or really can't fall asleep, then the supplements aren't designed for that. They were never meant to actually really treat that kind of problem. And so it's really unlikely to help. And
despite what some of them say on the boxes.
I know. The claims are really, really ridiculous sometimes. And I think that is a real problem because they say things like it's an evidence-based way or it's backed by science. And those claims in no way are accurate because they haven't been shown in peer-reviewed studies to help with sleep problems. And people will feel really desperate when they're not sleeping. And, people will literally sweep the supermarket shelves of these things. One of the issues is it can make people just feel like nothing will work. You tried this, you tried that, and then you think nothing's going to work and I'm going to be left in this way all the time. But actually, you've got to remember, they weren't ever meant to work. These aren't treatments for sleep problems. Perhaps they could boost it a little bit. But if you are struggling, definitely think about trying to get some evidence-based, treatment, like something like cognitive behavioural therapy for insomnia can be good. But speak to your doctor. There's medications that can help. There are other things that can work. And don't feel like just because these assortment of things that aren't helping, that nothing will.
Magnesium, that's one that a lot of people swear by.
Yeah.
What do we know magnesium and sleep?
So I think magnesium is debated, isn't it? Do you have this? So some people say everyone's deficient in magnesium, and some people say it's really hard to be deficient in magnesium. So what we know from the studies is that if you are deficient in magnesium, then your sleep can be poor. And if you replace the magnesium, it can help. But the studies really were done in kind of really elderly populations in nursing home where people were resident and they weren't getting enough magnesium. Now, there have been no other studies in other populations that have shown that magnesium can help. But it seems to be absolutely everywhere. Like, I don't think I have had a single patient who hasn't tried magnesium. So I don't find it very helpful. I don't think people that I see have found it very helpful for sleep problems like insomnia, but it's potentially, I don't think it does much. But again, it's very safe. And if someone finds it helpful, it's not going to do them any harm. But it'd be better just to have a really good varied diet.
I'm holding my leg up here. Do you? Because some people say they rub it on their lower legs, and that works. I guess that's to do with restless legs. And others say no, they take it as a supplement. And if they are taking it as a supplement or rubbing it on their legs, should they be doing this as well a couple of hours before they go to bed, or does it be or taking it in the morning, or what?
Yeah, I can't advise on that one. It isn't one that I recommend. It's one of the things, because it's so universally talked about, there have been some really good studies on magnesium. And again, if it works for you, that's absolutely brilliant. Keep going. But it isn't something I think we should, I wouldn't recommend it in terms of sleep treatment, because it just hasn't got the data to back it up.
Well, there you go. The other thing that people do swear by, should they be taking it for their part of their hormone replacement therapy, is Utrogestin at night.
Yeah.
Is that an option if you're struggling with sleep, to swap it from day to night?
Absolutely. So for anyone that's taking HRT and they've got a uterus, they're going to be having a progestogen of some kind. And so when they've studied, and this is something with quite good data, is they've looked at all the different progestogens, and micronized progesterone, or Utrogestan, is definitely the one that comes out on top for sleep. It has a breakdown product which is called allopregnanolone, and that sits in the GABA receptors. So it works in that way. But it works in a way that it has all of the benefits of a sleeping pill, which is because they work on the GABA receptors as well, but it doesn't have the downsides, so it doesn't have the risks. So it's actually really good for sleep for lots of women. Not everybody that takes it will get that benefit, but it can be brilliant for sleep. So if I was to pick,
using it vaginally, you're not going to get that benefit.
No, sadly not. That's the problem. So, but also I think it should always really be taken in the evening. If you're swallowing it orally, it should be taken either with dinner or a little bit later before bed. So, but not earlier than that, because of this potential effect where it can make you a bit drowsy. But you're right. If you have side effects from progesterone and it means you want to take it in the vagina, you don't get that benefit, because often the side effects are also related to that breakdown product, allopregnanolone, and that's part of the issue, which is a bit of a shame. So yes, definitely in HRT, it can be really helpful to take Utrogestan.
Yeah. Are there any other things that people should think about in terms of things that can help, before we quickly get on, of course, obviously, to the things that are going to make your sleeping worse?
Yeah, I suppose I think we've talked about all the foods and supplements, but I think also remembering, I've talked about temperature a little bit, is really helpful to make the room really quite cold, maybe colder than you think you need it. Particularly if you're having hot flashes and night sweats, that can be really, really helpful. So I definitely think temperature. And then I think the other things that I would always talk about, which are about the really regular routine and the wind down time, and actually some of the kind of sleepy teas and things like that, they can be really nice as part of a little ritual. And one of my other things was just having a little candle. It's got chamomile in it, but I think it's just about having that ritual before bed. It's not the chamomile, I don't think, that gives me good sleep, but actually just something that every night you're going to have a kind of nice thing. You're going to have a nice drink, a nice candle. You're making it a nice experience, a wind down experience, and that can be really helpful. And of course, our brains are really good at learning. And we can start to make associations with the things you do before bed and having sleep, and it starts to help to kind of build a bit of a sleep routine. So I think that
that's a nice idea, actually, because I think probably a lot of people, if you're anything like me, I eat late, and then because I'm lazy, I'll sit on the sofa until sort of 11:30. Then I'll get up and clean the kitchen and stack the dishwasher, and all of those things that actually really aren't very nice to do before you go to bed. It probably would be much better to switch that around a little bit.
It's worth a try.
Yeah, absolutely. And you mentioned the CBTI. That's a very, very important thing. I guess a couple of things that we know are not good for sleep is too much alcohol. Some people are very sensitive to caffeine. Are there any other things that perhaps should be avoided before bed and the blue light that you mentioned before? Anything else?
Yeah. So I think you've said it. Alcohol, we know, really disrupts that kind of rapid eye movement sleep, and that can make people feel really exhausted. But it also inhibits melatonin a bit, so it kind of works in the opposite way. Caffeine, exactly as you've said, having it after 12 can be really disruptive. Even if you don't think you're sensitive, it's probably not good for your sleep, even if you don't notice it. Oh dear. Okay, say no more. I'm not saying anything. And then screens, as you say. So with screens, and I can't remember if we've talked about this before, but it probably isn't the blue light. It's probably not the light. It's more what's on the screens that's the issue. So it's just really activating. And so anything that helps you really wind down and disconnect from work and from other things is a good thing. And then the other two things are, I mentioned exercise. So some people want to exercise late into the evening, and actually that can be quite disruptive. So if you struggle with sleep, you should just think, could you move your exercise a little bit earlier, because the body gets quite hot, and that's a problem. And then sugar. I think we mentioned it before, but you get that whole sugar rise, sugar crash, and that again is not ideal. So to have sugar much earlier in the day if you can, and not right before bed. Out
goes the chocolate.
Yeah.
There you go. Well, you've ruined my evening.
I know. Yeah, sorry, Fiona.
There you go. Well, brilliant. Is there anything else that we should throw at people in terms of that? Because or do we think we're done on sleep and food and supplements?
Yeah. I think we've covered most of it, haven't we? It'd be really interesting. I mean, some people have got things that will always work for them, and I always love hearing about that. So if people have got anything that they've found really useful, it would be great to hear about it. So maybe we'll see that in the comments. Yeah,
exactly. Now, because I didn't actually give you a particularly brilliant introduction, because I'm so excited about actually going on this live stream in two different directions. Where do people find you, darling?
I'm at Myla Health. So it is a women's health clinic. It's www.mylahealth.co.uk. And so we do menopause appointments and all sorts of women's health there.
Brilliant. And I think that's about it. And you're on Instagram. If people want to find you, where do they find you on Instagram? It's I'm very bad at this. What do you call it? What's your handle, baby?
I think it's Dr. Zoe Menopause.
I think it is.
It is Dr. Zoe Menopause. I think you might have to tag me in this, because I've slightly forgotten my handle. I haven't done it for a really long time. I haven't done an Insta Live for ages. Or this isn't even an Insta Live, is it? This is what do you call this?
Well, you're going everywhere. You're on Facebook and you're on YouTube simultaneously. We're talking to the world.
Yeah, brilliant. And, okay.
Yeah, brilliant. All right. Well, look, thank you so very, very much for that. And speaking of while we're on YouTube, my husband will kill me if I don't say this. If you like what you've seen on this, please subscribe and hit the like button.
Oh, brilliant. Well done, Fiona. All right. Lovely to see you.
You too. Thank you so much.
See you. Bye-bye.
Take care. Bye.